Hi, my name is Marlon Santiago Granda Torres. I'm a student of Catholic University of Santiago, Guayaquil. Here we have an introduction of the topic that is treatment of medically refractory essential tremor. First we have the definition. The refractory essential tremor is the most common movement disorder. It's a syndrome of unknown etiology characterized by a slowly progressive postural and or kinetic tremor, usually affecting both upper extremities. Fundamental debate exists as to whether essential tremor is a neurodegenerative disease. In medical applications, we have the symptomatology. The primary feature is kinetic tremor, affecting the hands and arms, although tremor may take on other forms like postural, intentional, and rest tremors. May affect other body regions, head and voice, and may be accompanied by additional motor features like ataxia and non-motor features. Here we have a video that explains the new treatment that is the ultrasound therapy.
We're very pleased to participate in an Insight Tech pivotal study, or phase 3 study, where we'll more thoroughly investigate the efficacy and safety of the procedure. So Insight Tech clinical trial that will be conducted at 8 centers around the world. I think 72 patients will be studied, and they'll be followed for a year, at least a year's time. A study like this will really allow us to much more definitively assess the safety and outcome of a procedure like focused ultrasound thallomotomy. These are patients with essential tremor, so they've been diagnosed by a movement disorder neurologist to have essential tremor. It's a fairly pure population of essential tremor. In other words, they don't have any overlap symptoms or any element of Parkinson's disease. Sometimes the two blend a little bit, so it's a very pure patient population of essential tremor. They have severe tremor. In other words, their tremor is very severe to the point that it's disabling or causes them disabilities in day-to-day activities like feeding themselves, dressing, writing, some of the basic activities that we take for granted. And then it obviously must be refractory to medical therapy. So these are tremors that don't respond to the usual medicines that neurologists will try.
That was the video. Now we have applications in Ecuador. Essential tremor is usually diagnosed here in Ecuador based on family history and examination findings. Thus, laboratory and imaging studies are usually not required. No biological markers exist for essential tremor. Electromyography or accelerometry can be used to assess tremor frequency, rhythmicity, and amplitude, but is not a part of the routine evaluation. Here we have the advantages. There are few available medications, with the mainstays of therapy being beta blockers, especially propranolol, the anti-epileptic drug primidone, and several medications that enhance delta-aminobutyric acid neurotransmission, but their efficacy is limited. One approach to the treatment of these patients is surgical, with deep brain stimulation being the most common surgical treatment, but actually is most used the ultrasound therapy. Here we have disadvantages. As with other such diseases, effective pharmacotherapies for essential tremor have been elusive. Also, there are proofs of studies that in some patients with refractory essential tremors, doctors found that this disease can be presented by genetic background. Here we have a video that explains the genetic background.
Your CNOS Health Watch on Siouxland News.
Tremors affect up to 10% of the population, but one type of tremor may even be linked to your family tree.
Siouxland News reporter Katie Link went to find out more.
Tremor is basically defined as an abnormal involuntary motor movement.
Dr. William Andrews, a neurologist at CNOS, says many times people associate tremors with Parkinson's disease, but there is another type of tremor that can run in families.
Called essential tremor, and this was previously referred to also as benign familial tremor, which indicates a fairly high frequency of a hereditary component to this type of a tremor.
Mainly seen in the face and hands, doctors will do tests to figure out what part of the brain is causing the tremors.
This causes interference with daily activities, including fine motor skills and daily activities of living, such as eating or drinking and things like that.
And while non-Parkinson's tremors can make daily life difficult, there are treatments that can help.
Diagnosed with tremor, there's a wide range of treatments that are available, ranging from medications to even surgical options to treat the tremor and improve the overall functioning for that patient.
For Siouxland News, I'm Katie Lang.
That was the video. And finally, we have the conclusion. Essential tremor is among the most prevalent neurological disease, estimated to affect approximately 7 million persons in the United States alone. The ultrasound therapy is the less invasive than other approaches because it does not involve boreholes and intracranial electrodes. The procedure may allow more patients to avoid a surgical option for the treatment. Thank you.